So again, our partners is Alianza Nacional de Campesinas, Rural Coalition, Coalition Rural Health, Rural Coalition, and MCN. If you have not done your interpretation, please do so now. Just a few reminders, please mute your microphone, use the chat feature if you need to go ahead and ask any questions or have some feedback.
Voy a dar esa instrucción únicamente en español, Moisés. Por favor, las personas que escojan en este momento el botón de traducción para el idioma que ustedes requieran. Y
buenos días, Alma. Disculpa, estábamos en otra línea acá, los de campesinos, y acabamos de coger el link, así que nos estamos conectando apenas, ¿ok?
De acuerdo, no se preocupe, Emma, estamos empezando con la reunión.
Muy bien.
Bienvenidos a todos, les estamos pidiendo nada más que escojan el botón de la traducción, que ustedes, el idioma en el que desean escuchar, y el compañero Moses Arjona continúa.
Disculpa, ¿tenemos que escoger uno o si somos bilingües podemos quedarnos en el que sea?
Correcto.
Ok, gracias.
Correcto.
MCN, together with the Alianza Nacional de Campesinas and partners, form a learning collaborative to train and provide evidence-based continuing education, technical assistance, and collaborative efforts to promote COVID-19 prevention and vaccination. So we're very excited to be part of this, and we're very excited that you all are here with us as well, because we want to learn from each other. Our agenda today will do some introductions, some organizational roll call, our needs assessment findings, our next steps in the evaluation, a COVID-19 update on variants, and of course, questions. So our presenters today, we're going to have an introduction by Ms. Milly Treviño Salceda, Amy Lieben, Alma Galvan, myself, Moises Arjona, Maricel Payan Santana, and Dr. Lázaro Madare.
Mr. Moses.
Yes.
There's others trying to get into the conference, and they're the Zoom is saying they're still waiting to be entered in.
Sure. Esther, can you monitor the wait room, please?
Thank you.
Thank you.
Moses, why don't you make me a co-host as well, and I can assist. I think there's some slowness with some internet, and I can help out.
Done. And I did put the link to the meeting room in the chat. So in case somebody has an old link, you might want to send them the new link just in case. Millie, would you please go ahead and say something about the Learning Collaborative before we begin?
Sí, buenos días. Estoy súper contenta que yo soy Milly Treviño Sauceda con Alianza Nacional de Campesinas y estoy súper contenta que estamos haciendo esta colaboración con el Migrant Clinicians Network porque, y con la Coalición Rural, porque esta es una gran oportunidad para conocernos, para saber cómo podemos aprender a unas personas de otras y compartir cuáles son los retos, cuáles son los problemas, cuáles son las necesidades, pero también cuáles son los esfuerzos que estamos organizando, ¿verdad? Y sabemos que Migrant Clinicians Network, Amy, nos conocemos de tiempo, Alma, tenemos rato. Sabemos que el Migrant Clinicians Network tiene una manera de cómo hacer el trabajo muy única y por eso quisimos que entrara en esta colaborativa, en este trabajo y yo quedé muy impresionada mirando el material y todo, así es que vamos a estar aprendiendo juntos juntas en esto y vamos a darnos muchísimas más ideas cómo hacer mejor el trabajo y porque queremos ya terminar esta pandemia y queremos hacerlo juntas, juntos. Muchísimas gracias porque estamos en esta colaborativa y pues vamos a estar hablando cada semana y después MCN, Amy va a explicar un poquito más y Moisés y Alma. Muchas gracias. Ya paro aquí porque ya saben que yo hablo mucho. Gracias.
Thank you, Millie. Amy, would you like to go ahead and say something before we begin?
Did you ask me, Moses?
Yes.
Hi, I know I'll speak English, but bienvenidos a todos. Welcome, everyone. Migrant Clinicians Network is so excited to partner really with a lot of, I don't want to call us old, but some old friends. We've worked together for many, many years with many of the groups here. So we're excited to be a part of this amazing project. And we're excited to really take the lead as facilitators of a learning process. And really our idea is that we learn from each other when it is July 2021, and we have been together in this pandemic for a long time. And there is an amazing amount of expertise in this room. And I am so excited to work together, to learn from each other, to learn from different strategies. And that's really the point of this learning collaborative. We will also try each week, in addition to learning from each other, to bring you the most up-to-date information about COVID-19. We know, again, this point in the pandemic, that sometimes each day, each week, each month, we are learning new things, and that helps us in our understanding in trying to reach the groups and the people and the neighborhoods and the communities that we want to reach in order to help them stay healthy and get vaccinated with the COVID-19 vaccine. So again, welcome. I'm excited to be with new friends, with old friends, and I will hand it over to Alma.
Buenos días a todos y todas. Muchísimas gracias por estar con nosotros y bueno, solamente reiterarles a ustedes que esta comunidad de aprendizaje es una oportunidad excelente para todos nosotros de aprender de ustedes y que todos aprendamos de lo que cada quien hace. La idea de todo esto es recoger precisamente lo que cada uno de nosotros está haciendo y potenciarlo. Hemos trabajado mucho y queremos capitalizar en lo que todos y cada uno de ustedes ha trabajado y continuar haciendo cosas nuevas. Bienvenidos de nuevo. Moses?
Sure. So with that, I will go ahead and get started on our roll call. And thank you all. I'm excited to be here and part of the team. And again, you'll hear more from our other two team members in a few minutes. So I'm just going to go down by each organization. And if somebody from the organization could go ahead and let us know that they're present, and go ahead and let us know who from the organization is with them on this call today. So of course it's by alphabetical order, so you should know when you're coming up. So we'll start with Alabama Association of Cooperatives. All right, great. Alianza Nacional de Campesinas. I know we have a huge team here, so great.
Moses,
Yeah.
John was raising his hand, so some people are on the phone, so just go ahead and just introduce them as they raise their hand or if they want to speak.
Awesome. American Indian Mothers.
And cheer everyone. I'm Beverly Collins, and I also have on the phone with us Miss Michelle. She's our data person, and then we have Miss Lisa. She's our RN.
Great, welcome. American Indian Movement Interpretive Center.
Morning, bonjour, everybody. This is Lisa Bellinger out of Minneapolis, but calling in from Pipestone, Minnesota. And I believe, I'm not sure if Fawn is on with us or not. So, but I'm here.
Awesome. Welcome. Border Agricultural Workers Project.
Buenos días, Carlos Marentes presente.
Felicidades, bienvenido. Campesinos Sin Fronteras.
Sí, buenos días. Aquí estoy, Emma Torres, y también está Rogelio, está Rosa, Idolina, Lili y Alejandra.
Buenos días, gracias. Centros de los Derechos del Migrante.
Buenos días, soy Rachel y también me acompañan Andy y Christine. Buenos días, un gusto estar con ustedes.
Buenos días, bienvenida. Campaneras Campesinas.
Buenos días, Rosa Saavedra y Jocelina Paintal presente.
Welcome, gracias. Cottage House, Inc.
Good morning, everyone. Barbara Shipman and my husband, Roy Shipman from Alabama. We're on together.
Welcome. De Campesinas a Campesinas.
Elizabeth Cordero y Carmen Obeso, Oxnard, California.
Bienvenidas. Farm Worker Association of Florida. I don't see any hands going up.
No veo yo tampoco.
Okidoki. Grupo Amor.
Irma Durán de Grupo Amor Homestead, Florida.
Okidoki. Thank you. Kansas Black Farmers Association.
We bring you greetings from historic Nicodemus, Kansas. This is Dr. Johnella Holmes. I'm the executive director, and I have online Dr. Tammy Counts, who will be our program director. And I also have Miss Lucrecia Horn, who will be our data collector.
Great, welcome.
Bienvenidas.
La Mujer Obrera.
Good morning, I'm Celia Aguilar here out of El Paso. Happy to be here.
Welcome. Líderes Campesinas.
Hello, good morning. My name is Juanita Montoya with Líderes Campesinas in Kern, and I'm also so happy to be here.
Great, welcome. Líderes Campesinas of California. Nobody raising their hand?
I think Líderes Campesinas and Líderes Campesinas of California is the same organization, so
Okay.
I'm not necessarily sure.
You might be right.
Yeah.
Mujeres Divinas.
Hola a todos, otra vez, buenos días a todas y a todos. Estamos Alma González, Dolores Bustamante y su servidora de Nueva York.
Gracias, mucho gusto. Mujeres luchadoras progresistas.
Perdón, hola, buenos días. Mi nombre es Francisca Aparicio del estado de Oregon. Estoy con Rebeca Velázquez.
Buenos días, bienvenidas. Oklahoma Black Historical Research Project, Inc.
I don't see them now. This is Lorette Pachano. I'm trying to reach out to them because I don't know if they were having trouble with the link. So hopefully we'll get them connected shortly.
Thank you, Lorette. Operation Spring Plant.
Good morning, Dorothy Barker, Oxford, North Carolina.
Welcome. Petula Ministries.
Good morning. I'm Dr. Dawn Baldwin Gibson. I bring you greetings from New Bern, North Carolina. It is great to be with you all, and I am joined. I serve as executive director at Peloton Ministries, and we have online with us Ms. Demetrius Hicks, who is our program admin assistant for this great project. So thank you, and we're glad to be a part of this community.
Welcome. Awesome. Thank you. Purdue. I don't think we have anybody from that group present.
I don't see no one.
Okay, Rural Advancement Fund of the National Sharecroppers Fund. All right.
I don't see them, but I'm reaching out to them as well.
And then of course, for the Rural Coalition, Lorette, you can.
Yes, I'm Lorette Pachano with the Rural Coalition, and I'm here with my colleagues. I believe that Corinne Meyer Rodriguez and Andy Laurie Anderson Laza are here.
Great. Did I leave
Moises, yeah, Moises, when you mention Alianza, it's important for me to, va a ser importante para mí compartir que tenemos el personal clave de lo que es el equipo que está administrando todo esto. Como saben, Alianza es la organización, Alianza Nacional de Campesinas es la organización que ayudó a hacer la aplicación, y hay, nada más para información de todas las personas presentes, hay varios grupos con los que estamos trabajando y que a lo mejor por lo mismo no fueron necesariamente incluidos porque apenas recibiste la información ayer. Está un grupo de Indiana, está por medio de María Esparza, tenemos sí, está lo de Mujeres Divinas, claro, y hay un grupo en el Valle de Coachella que está trabajando, que le llamamos el sureste de California. Y básicamente tenemos al personal que es Ana Obregón, ella es la encargada de supervisar todo el programa nacional. Ella tiene, su función es supervisora del programa nacional de HRSA, es Ana Obregón. Y también tenemos a Marlene Rojas, que junto con Elvira Carvajal, que están ayudando a coordinar el programa nacional, ¿verdad? Son las que están coordinando. Y tenemos otro personal que están ayudando, asistiendo al programa, y que vamos a querer trabajar con todos los diferentes organizaciones asociadas en la aplicación que hicimos, ¿verdad? En la aplicación que hicimos está Campesinos Sin Fronteras, está la Asociación Campesina, está la Coalición Rural, y por medio de la Coalición Rural entraron 13, 14 grupos, está Líderes Campesinas, y también, no sé si estoy, el CDM, el Centro de los Derechos del Migrante. Estos grupos nos unimos y ayudamos a que estamos representando 20, creo que son 20 estados de la nación americana. Entonces, nada más quería reconocer, ¿verdad?, que gracias a esta colaborativa estamos tratando de asegurar, junto con el Migrant Clinicians Network, llevar a cabo lo más detallado posible, porque estamos trabajando acabamos de terminar de tener una llamada con la Program Officer, con la oficial de programas, y ella sí nos está recordando que tenemos que asegurar que le estamos entregando la información a tiempo. Vamos a hablar después con ustedes sobre eso. Muchísimas gracias. Nada más quería tomarme este tiempo para, ya que están todos los grupos aquí presentes, dejarles saber que gracias a ustedes que quisieron ser parte de esta gran colaborativa. Estamos aquí ahora trabajando con MCN para no solamente aprender, como dije, sino ver cómo tenemos un programa exitoso y que se acabe esta pandemia. Gracias.
Thank you, Millie. Did we leave any groups out by any chance? I think Millie captured everybody, but I just want to make sure I didn't leave anybody out. All right, so as Millie said, 20 states, and we have also Puerto Rico, who's being covered. So this is our scope of work and where we're all at. So we're doing a lot of work and we're really proud. We're really happy. I will go ahead and give it over to Willie Matt to go ahead and take over.
Sí. Muy buenos días. Mi nombre es Will María de Jesús. Estoy trabajando acá como analista de datos en el equipo de evaluación con NCM y nosotros vamos a ser ese equipo que va a estar un poquito facilitando el proceso. Así que van a esos surveys o esas encuestas que van a estar recibiendo, cómo lo fue el estudio de necesidades, los prepara entonces este equipo que también está compuesto por la doctora Maricel Pagán y Aníbal López Correa, que no pudo estar en el día de hoy acá con nosotros. Lo que nosotros buscábamos dentro de este proceso y que ustedes vieran, 21 de las organizaciones respondieron a ese Needs Assessment. Y lo que buscábamos era que ustedes conocieran un poco de cuáles son esa información que recopilamos. De esa información nosotros encontramos que todas las organizaciones que están aquí presentes asisten en el proceso de los individuos para obtener una cita para vacunarse. Hay diferentes actividades que se van a estar realizando por parte de las diferentes organizaciones y es importante que conozcamos cómo se da ese proceso y que no estamos solos en cuál es la iniciativa que estamos utilizando. Además de eso, sobre el 90% de las organizaciones que tenemos van a estar distribuyendo materiales impresos, van a estar haciendo colaboraciones con spokespersons o líderes comunitarios que ayuden a ese proceso de conexión y la coordinación de las citas de vacunación. Y solo el 80% de esas organizaciones son las que van a proveer transportación a los centros de vacunación y van a hacer llamadas de recordatorio en ese proceso de vacunación. Así que es un poquito hay diferentes estrategias que se ajustan a las necesidades de las comunidades, pero queríamos que conocieran un poco el marco general de lo que está pasando. Una vez nosotros establecemos cuáles son las actividades, de ahí esas son ese proceso las que se van a evaluar. Nosotros hemos diseñado entonces una herramienta que nos va a permitir evaluar cómo se trabajan con esas actividades. Así que dentro de ese estudio de necesidades también encontramos que la mayoría de las comunicaciones que ustedes como organizaciones realizan, las realizan en inglés, siendo el español el segundo idioma, pero tenemos algunas organizaciones específicas que trabajan también con el creolo, algún otro idioma en específico que se esté trabajando, pero principalmente se hace en español e en inglés en la mayoría de los casos, que también eso nos ayuda a nosotros a enfocar cómo va a ser ese proceso y quizás cuál es nuestra mejor herramienta para comunicarnos. Luego de eso, bien importante en ese proceso, nosotros también medimos cuáles son las estrategias que se utilizan para ese proceso de vacunación, siendo, y esto es bien importante en el proceso, siendo eventos comunitarios y la distribución de material impreso las principales, quizás los principales métodos que se utilizan por parte de las organizaciones que están aquí en este colaboratorio, pero siendo las redes sociales tercera tipo de actividad que se realiza, si bien tienen otras actividades como eventos radiales, podcasts, correos o tipos de llamadas que se hacen a los diferentes lugares. Creemos importante señalar tres opciones que son las que sobresalen sobre el resto de ellas. Y esos pequeños detalles los que tratamos de mirar para ajustarnos a cómo ustedes trabajan y qué cosas entonces o necesidades ustedes van a estar viendo. Una vez nosotros establecemos lo que ustedes ya hacen, les preguntamos un poco sobre sus retos y que ustedes como organizaciones identificaron que eran algunas de esos retos presentables y que los compartieron. Nosotros quisimos unir todos los retos y ver un poco cuál era la frecuencia de cuáles eran los retos que se presentaban alrededor de todas las organizaciones. Y por ejemplo vimos que la falta de información o de material, también de transportación en el proceso, definitivamente está trabajando con esa parte. Dentro de lo demás y lo que nos llamó mucho la atención con este proceso de retos es haber identificado esa parte del acceso a la información y acceso a el training o cómo trabajar con ese miedo que puedan tener los diferentes, con las diferentes áreas y las necesidades que tiene su organización. Entonces, habiendo y teniendo eso en consideración, pues los compañeros de NCN, Alma, Moises, han estado trabajando con un currículo que pueda atender esas mismas necesidades que ustedes tienen, que sabemos que entonces quizás podamos contribuir y trabajar juntos para aprender de cómo entonces podemos cerrar ese espacio entre unas cosas y las otras. Y así, pues, esto fue una pequeña muestra de las cosas que nosotros recopilamos de la información que ustedes proveen. El objetivo final de esto es que ustedes puedan proveernos proveernos los reportes mensuales que ayuden no solamente a lo que es Alianza a poder reportar a HERSA la información necesaria, pero sí también que ustedes puedan tener una idea clara de cuál es el proceso y el progreso que ustedes están llevando a cabo, que sea un espacio colaborativo donde ustedes puedan ver qué está ocurriendo, cuáles son sus necesidades, cómo nosotros quizás podemos ayudarlos en el proceso y que ustedes tengan ese procesamiento de los datos que se recogen, no solamente que esos datos lleguen para propósitos federales de reporte, sino para propósitos de mejorar esas intervenciones que ustedes están haciendo. Así que hay unas pequeñas cosas técnicas en esa parte sobre que el enlace del reporte se va a enviar el día 2 de cada mes a todas las organizaciones y MCN entonces va a recibir ese informe, van a tener un enlace similar al enlace que ustedes tuvieron para el Needs Assessment o para el Needs Assessment. Y entonces esa información nosotros la pedimos que por favor la completen lo antes posible para que entonces MCN le pueda enviar a Alianza antes del día 4 de cada mes la información necesaria para que ellos puedan someter un reporte. Ustedes no los envían, nosotros compilamos toda esa información y entonces la podemos, Alianza la pueda presentar en el informe mensual a HERSA. Nosotros también en los próximos pasos para el proceso de evaluación nos gustaría poder...
Wilmar, can you hold on for a minute? Can you hold on for a minute? Great.
Sure.
So Millie, this is the part that you were talking about a little while ago about the reporting. And just to reiterate, there will be a report link sent out to each organization on the 2nd of each month. MCN will then compile that information and send it back to Alianza by the 4th of each month. And then Alianza will then have time to ask questions, get clarifications, and submit the report ready for HERSA. Now, previously we had said that we would do bi-weekly evaluation submissions of the reporting, but after speaking with many of the partners, we heard your concerns. We do not want to over-report. We do not want to duplicate reports, and we want to go ahead and be consistent and make your life easier. So, Millie, anything you want to add to this part, Millie?
Sí, queremos ayudarles a que no se les haga tan difícil, pero también queremos que entiendan que nosotros tampoco queremos tener una situación difícil. En el último reporte hubo varias organizaciones que entregaron su reporte, algunos 2 horas antes de entregar el reporte, nosotros a HERSA, el mero día 7, otros lo entregaron un día antes, otros lo entregaron 2 días antes, cuando habíamos dicho que el día 3. Ahorita MCN está diciendo que el día 2 se necesita entregar esa información. Vamos a revisar, va a ser por medio de MCN, ¿no? Moisés, ustedes van a estar, y MCN va a asegurar que esos 2 días que siguen van a tener esa información para nosotras. Entonces, ya no se va a permitir que un día antes o el mismo día estén entregando el reporte, por favor, porque eso nos va a poner en mal si no entregamos el reporte a tiempo. Es un proyecto muy rápido, es un proyecto nada más nos quedan 4 meses y medio, así es que queremos mucho su colaboración. Gracias.
Great. Thank you. And before the end of the day or before the end of the week, I'll send a friendly reminder on your calendar to put it on there that the report will be due, just to have it on your radar. I'll give it back to Willy Mar.
Sí, nosotros ahora queríamos compartir un momento, y si me permites, Moisés, para poder presentar mi pantalla rápidamente sobre el tablero. Nosotros, nuestro objetivo con este proceso es que también ustedes puedan acceder a unos tableros de resultados y progresos, que de ahora en adelante les vamos a decir dashboard para cuestión de proceso, individualizados por cada una de sus organizaciones. Con la información que ustedes nos proveen en cada uno de esos reportes, en ese Needs Assessment, nosotros hemos ido preparando una serie de dashboards personalizados que le va a ayudar a usted y a su organización a ver más claramente cuál es la información que estamos manejando y que no se pierda en el resto de la información que se trabaja como proyecto en general. Entonces, a esos efectos, yo voy rápidamente acá a compartir con ustedes un ejemplo de lo que sería un dashboard. En este caso, utilizamos una de las organizaciones, no los vamos a presentar todos los dashboards ahora, pero vamos a presentar el dashboard de la organización, lo que sería Farm Worker Association of Florida, que fueron de hecho los primeros que llenaron nuestro Needs Assessment, y que entonces nos dio la oportunidad a poder preparar quizás un poquito más detallado. ¿Todos pueden ver mi pantalla? Moses, para confirmar.
Sí.
Ok, perfecto. Dentro de esos dashboards, nosotros queremos un poco personalizarlo a la historia y a lo que es su organización y qué es lo que ustedes quieren ver. Y por eso la intención de reunirnos con cada uno de ustedes, porque quizás lo que es más importante para una organización no es más importante para la otra, y porque las estrategias que ustedes van a estar utilizando para llegar a esas comunidades no va a ser la misma en todos los espacios. Entonces, por ejemplo, en esta organización en específico, tenemos que ellos tienen unos goals o unas metas y unas necesidades específicas a ellas, igual que unas metas específicas de cuántas quieren que sean esos community health workers que van a estar trabajando junto con ellos. Así que definitivamente nosotros vamos hablando un poco de esa información que ustedes nos están presentando, y vamos tomándola y colocándola en estos dashboards que permiten más fácilmente que ustedes puedan visibilizar la información. Nosotros vamos a compartir con ustedes más adelante un enlace para que podamos ir coordinando las horas y la fecha que a ustedes más les convengan para reunirnos, y que pueda hacer lo antes posible para tener entonces y desarrollarles ese dashboard a cada una de las organizaciones. Nuestro objetivo con esto es que podamos seguir añadiendo más adelante información según ocurre en el proyecto, y que entonces podamos trabajar con las diferentes visualizaciones de información, porque no queremos simplemente, que era lo que les estaba mencionando anteriormente, no queremos simplemente que ustedes tengan que nos provean estos datos sin que ustedes vean qué se hace con estos datos, qué material nosotros podemos trabajar, cómo podemos evaluarlo para saber cuán cerca o cuán lejos estamos de nuestras metas y objetivos trazados principalmente. Así que en ese aspecto, este es un ejemplo. Nosotros podemos cambiar este dashboard, es completamente interactivo. Nosotros podemos ir cambiándolo y ajustándolo, que pueden ver que las diferentes áreas se mueven y podemos añadir y retirar información del mismo. Así que esperamos y estamos muy entusiasmados de poder trabajar con ustedes en cuanto a estos aspectos. Moses, it's back to you.
Thank you. I'm going to go ahead and share my screen again. And I want to introduce Dr. Laszlo Maderas to go ahead and do our COVID update.
Okay.
And if you just
I'm sorry, Moses,
Monday.
can I just, there is a question in the chat about the way, perdón, voy a hablar en español. Hay una pregunta en el chat de que si vamos a tener un sistema de reporte a través de los celulares y vamos a tener una sesión específica sobre evaluación y cómo ustedes van a recoger cada uno de los datos. Gracias por la pregunta, John. Y vamos a continuar con eso. ¿Ok?
Además, si me permite abundar un poco más a la pregunta, John, el sistema que utilizamos nosotros para reporting es amistoso con teléfonos celulares. Así que se adapta para que pueda llenarlo desde el celular, si es el caso, pero cuando nos reunamos con la organización de usted podemos ir al detalle en cuáles son las necesidades de reportar y podemos adaptarlo aún mejor para que sea más fácil ese proceso.
Gracias, Maricel. Adelante, Moses.
Alma, parece que todavía hay gente esperando para entrar, o si pueden revisar eso. Gracias.
Esther, si me haces el favor.
Ok. ¿Se puede empezar?
Sí.
Buenos días a todos.
Gracias.
Soy doctor Maderas. Voy a presentar en inglés, pero entiendo un poco de español también. Si usted tiene alguna pregunta en español, es muy bien también. So I'm Dr. Laszlo Maderas. I'm the Chief Medical Officer for Migrant Clinicians Network. And I've been working with farm workers for about 25 years in South Central Pennsylvania in the Gettysburg area. And I'm a family physician, and I'm also a hospital doctor. And I'm talking to you right now from Chambersburg Hospital in Chambersburg, Pennsylvania. And I want to say thank you all for the important work that you are doing. All of you who work in your communities, who know the culture and the language and the customs, you've built up a trusting relationship with the people that you serve. And I know it's been a very difficult year. I've been working with COVID patients in the hospital as well. And I just want to thank you from the bottom of my heart for the hard work that you have been doing and the incredible strains that are put on the communities that we care about over the past year and a half. So thank you very much. So I'm going to talk about COVID-19 and the variants of this virus and why do we care that there are variants. Next slide. Yeah. Okay, so why we care about the virus itself that presented originally in last year in 2020 is that it had passed through the whole world one time, and many people got sick and many people died, and it's still ongoing in many parts of the world. We have now been fortunate in much of the West, but not everywhere, to have the opportunity to get a vaccine for this. Other parts of the world are still under-vaccinated, and the WHO is working on trying to get the vaccine to all parts of the world. For us, in the United States, especially, we've been able to get the vaccine in many places. We're still under-vaccinated overall, but we're doing better than much of the rest of the world. But in the meantime, the people who are still getting sick with this virus are getting both the standard, the older version of the virus, and some of the new variants. The new variants were named after different parts of where they came from in the world. So they came from the Greek alphabet, alpha, beta, delta, gamma, epsilon, etc. And the variant that's worrying us the most right now is the Delta variant. And so the Delta variant seems to be a strain, a different form of the virus that's easier to catch and spreads faster. Again, more than half the cases in the United States are now caused by the Delta variant. It's more transmissible than the original coronavirus, and we are seeing a rise in the cases in the United States due largely to this Delta variant. So this virus is mutating, it's changing what it's trying to do is the outer coat, the protein that lets it get into the cells of animals and people, is changing and becoming easier to enter into different types of cells. Mostly what we're caring about here is the human cells. The vaccine itself, COVID-19 vaccine, has been very effective as far as we can tell, for the Delta variant at this time. We're hoping that that remains the case, but as the rest of the world is trying to catch up and get vaccinated, there'll still be many people who are under-vaccinated or unvaccinated who may also get the newer variants as they come along. As Amy mentioned, right now we're giving information from July 2021. Last year, we didn't know any of this. Next year, we'll know much more. So as the information comes around and develops as we know more, we'll continue to talk and teach and have sessions like this to update what's happening in the viral development of different varieties. Okay, next slide. So the COVID-19 vaccines are very effective in protecting people from severe infection, hospitalizations, and death from the Delta variant. This is something that I found in my own professional life. Is when I work in the hospital, I admit those people who are too sick to stay at home. And almost everybody now that I see in the hospital is somebody who has not gotten a chance or has declined the opportunity to get the vaccine that is available. So most of the people who are the sickest now end up in the hospital that I end up seeing as a doctor are people who have not gotten the vaccination yet. And I think the new variants coming along hopefully won't be as deleterious to our population, but we just don't know that. So I recommend vaccinating everybody who qualifies. Next. So yeah, getting vaccinated is very important. And the variety of vaccines that are out there, whichever is available in your community, I would use that one. It's a question of, can we wait for other vaccinations? That's really hard to know when other ones are available, but I think the ones that are available now are working well and should be used. This Delta variant is very worrisome to me also. We've had a couple of people just in the last week, in this July 4th weekend, who had picnics and they got together. And these are people in the community who had not been vaccinated. Their family members were not vaccinated. And I'd admitted them a week ago into the hospital. And one of them, who was otherwise young and healthy in their mid-50s, just died yesterday. And this is very, very sad, because this could have been an avoidable death if he had chosen to get vaccinated. So I really, really would like to encourage everybody to get their population vaccinated as soon as possible. I think that's all I'm going to be presenting right now. But again, if you have any questions, I'll be here till the end, and I'd be happy to answer questions as well. So thank you very much. And again, thank you for all the hard work that you do in these difficult times. I really, really think it's very important and very appreciative.
Thank you, Dr. Medeiros. So we have some time available right now for questions. If you'd like to go ahead and put them in the chat for Dr. Medeiros, he can go ahead and answer them for you. Or if you'd like to go ahead and raise your hand and unmute yourself, you're welcome to do that as well.
I wanted to ask the doctor, have you encountered many children under the age of 12 who are now getting infected because the vaccines are not available to them?
So that's a good question. Yeah, so we do have a pediatric population here that we worry about. We have not had to hospitalize anybody under the age of 12 now with that complication. Fortunately, at this point, I have talked to some of my colleagues who are emergency room physicians in the Washington, D.C. area. So that's about an hour and a half from where I work. and they have seen a few cases. And this is one of the things that is very hard to see, because children can get other complications from this virus as they can from getting other viruses for which there are vaccinations. So I would, at this point, we don't have the children under 12 being vaccinated, but I do encourage, as the CDC comes out with their recommendations to vaccinate, I would like to encourage people to please vaccinate, because there are going to be other consequences that we may not know of at this point for people who are not vaccinated. They recover, I get to discharge them from the hospital. I said, God bless you, go out there. And many of them have become, my greatest allies in convincing the rest of their population to please get vaccinated. So my patients who survive are very grateful, and often are the best spokespeople for getting vaccinated now, and not wait till you get so sick that you need to be in the intensive care unit. The question of the children, yeah, that's going to be, I'm waiting for the CDC to say when they can get the younger children vaccinated. But I haven't seen them a lot yet myself here in this part of the country.
Laszlo, pediatricians are saying that they anticipate sometime this fall that there should be some emergency use authorization for children under 12, but we will not know that until they actually do that. But that's what pediatricians told us.
Yeah.
My
that's why I say
daughter-
we don't have it yet, but we're waiting for that to come out and the CDC to recommend. Thank you, Amy. Yeah.
My daughter is a pediatrician in Lake Charles, Louisiana. And I spoke with her this weekend, and basically the pediatric beds for coronavirus are full in Lake Charles, and they're sending people on to other Alexandria and Shreveport and other places. And that really worried me. And that's
Sure.
why that's partially why I asked the question, because
Right.
that there is unfortunately not yet a vaccine for them. And if they are getting this disease, that's really disturbing.
Yes, no, I agree with you. That's why I said my colleagues in Washington DC have seen some of that, and I have not yet seen that in our community, and it could very well be coming. There's pockets of places where I think it can be dangerous, and all the more reason to try to get our population up from 47% of Americans being vaccinated to hopefully 70% and above. There's a question about pregnant women, and I have followed this closely. I have delivered babies for many years as a family physician, and I have close contact with our OB doctors here in our community as well, and they are strongly recommending, as does the CDC, to vaccinate pregnant women. I think that's still very important.
Laszlo?
Yes.
We have another question about a third dose, but before we get to that question, I want to underscore the conversation about what's happening in Lake Charles. And one of the great things about this project is that we have a lot of groups working in different zip codes, different communities, and many of the communities have very low rates of vaccination. And so Lake Charles, Louisiana, is part of a state where the overall vaccination rates are low, which is likely why in Lake Charles, we're seeing more kids being admitted. So in the areas where we have low vaccination rates, we're very concerned about those communities, and of course, concerned about members of those communities who are unable to get the vaccine. So that's something that's really hard to watch, but at the same time, exciting about this project because we're working in so many underserved and under-vaccinated communities.
Yeah, excellent point, Amy. Thank you. Yes, that's right. Deberíamos saber cuántas variantes sorry. There's a question here, deberíamos saber cuántas variantes más hay. So we don't know exactly how many more there will be. We're sort of going down the Greek alphabet as we find them. I'm assuming that if we talk about this in 6 months or a year, we're going to have more varieties. The important thing to know is that so far as we know, the Pfizer and the Moderna vaccines have shown good sensitivity to cover us for the Delta variant. But we don't know, as time goes on, viruses change, and part of their role is to get into another organism, either an animal or a human, and use their genetic resources to make more of themselves. And so as they change little bits of what they call a spike protein, which is kind of like the key to unlock the door to get inside the cell, that the key may change to be more effective in some ways, and that's what the Delta variant has done. So as time goes on, we may have more variants. And this is, again, going to Amy's point, the importance of vaccinating an entire community, because if we vaccinate a large amount of people, then the virus doesn't have a foot to get into the places where populations who may be otherwise vulnerable would get very sick. If we have most people covered, the virus just can't spread. If it can't spread, it can't create more varieties and populate more people because they're immune from having had the vaccine.
Les,
yeah.
Would you mind going back to Mr. Morente's question about the third dose?
Yeah, so I think as MCN, we have not tackled this subject at this time. And I don't want to speak out of turn for representing MCN, but what I would like to say is that Pfizer is recommending or thinking about this. And I would encourage Pfizer to look at and do a study of this. I don't believe the CDC and definitely not the WHO has recommended this at this time. One of the concerns, and I will speak as somebody who is also an epidemiologist, I have an MPH and I do global medicine. I personally would feel much more secure having gotten 2 Pfizer vaccines already, not to get a third one, but to take that third vaccine and vaccinate somebody else in different part of the world where there is like a healthcare worker in Honduras or Mexico or Guatemala or Brazil, and who hasn't gotten their first dose yet. Because if we can vaccinate globally rather than try to do a third vaccine for somebody like me who's already gotten 2, I would feel much more secure knowing that the virus is being beaten down better.
I just want to clarify the question, and I think that at this time, it's very important to underscore that the World Health Organization and the Centers for Disease Control are not recommending an additional dose. However, Pfizer and some of the companies are beginning to study this, and we may see in the near future a need for this. Right now, the debate is still out there, and also the debate about the timing when we would need it. So those are some things, and why we are doing this learning collaborative, which as that information, as the science comes out, we will be able to give you a very clear answer. But at this time, it is not recommended for a third dose, but it's coming soon on sort of what the science will say.
Sorry, Amy, I think I froze. You guys hear me now?
Yes, yes.
Okay, sorry about that. I don't know where I froze, but yeah, so I followed what you had just said. And what I also wanted to say, and I don't know if I'm repeating myself now, but I would prefer to have somebody else, another healthcare worker who has not been vaccinated, who is on the front lines in Honduras or Brazil or somewhere else, get the first of their vaccines rather than me getting a third one. As a healthcare worker myself, I would feel much more protected in a global perspective when all of us are being vaccinated rather than me per se getting a third vaccine. I've already gotten 2 Pfizer vaccines earlier this year, and I feel like that the important thing at this point is to try to use the vaccines that we have to get to the rest of the people who are not vaccinated or under vaccinated first. But I do want to see the research being done by Pfizer. I encourage their research to continue. I'm not discouraging that at all, but I can't say that, you know, getting myself, for example, a third vaccine would make me feel any more secure than if I knew that the rest of my clinicians, people out there working with populations, our nurses, other doctors, other health community workers are getting their vaccinations and getting that to the population. I feel much more secure in that scenario than I would say me. I got 3 vaccines and much of the rest of the world has not got any yet.
Thank you. Thank you. We have some more questions, so I'm going to help field them for you. Emma just had to leave, but she was wondering if we know if there is a certain variant that might be affecting agricultural workers more.
Oh, yeah. I don't know if we have that data. There is you know, these variants have become the Delta came, I believe we originally found it in India and it passed through many people there. And it's now becoming the dominant variant in the United States very quickly. So there's a good chance. Yeah, it's a good chance that what we're seeing is Delta, but we don't have the data to say that definitively. But Amy, I think exactly what you were saying earlier, that if we have large pockets in the United States that are under-vaccinated, then more people are going to get sick. And even if those people recover and do fine, just being incubated in those people, this virus can form new variants. So the more chance it has to infect people, even if those particular people are not, you know, didn't die, they can spread that to other people who then will be much more, you know, vulnerable, including the children. So I think that is a huge, you know, takeaway point. Like
Dr. Laz, we have another question. Okay. It's a really important one for all of us to really make sure that we're comfortable with. And Michelle is asking, do people who have already had COVID and therefore who have antibodies, do those folks need to get vaccinated?
So I would say yes. The antibodies that we have studied will last in your system for at least 3 months by and large. But this is the challenge for everybody. We're all a little bit different. Each one of us has a different immune system. Some people are immunocompromised and they don't respond well to either the vaccine or even building up antibodies after they've had the virus itself. So the immunity that we have may go on for a longer period of time for some people, but for other people, it may decline sooner than we would like. So I think the last that I've read in the CDC reports is that wait 90 days after you've been diagnosed and treated with COVID to get vaccinated, and the recommendation is still to get vaccinated. I don't know if this is going to change over time, but I would not say that if you're an older person who has diabetes and rheumatoid arthritis and your doctor has put you on immunosuppressive medications, that you can count on having had COVID and survived it. Thankfully, you survived it, but you can't depend on your immune system to say, you know, you're good for the rest of your life. I would still, you're my patient, I would still vaccinate you. And I don't know if you want to add anything to that.
Yeah, so just to underscore again, right now, regardless of whether or not you've been infected and have recovered from COVID-19, the Centers for Disease Control is recommending for everyone that is eligible to be vaccinated. Yeah. Dr. Laz, there's another question coming from Marlena Rojas asking about teenagers. So right now, the vaccine is, the Pfizer vaccine is allowed for teens who are ages 12 through 16. And she's saying, can teens have only one vaccine, or do they need to take 2 doses as well? And what about if a person receives only 1 dose? Is that enough?
Yeah, so I would go with the recommendations we have from the CDC, which is for the Pfizer and Moderna is to get two vaccinations. In the one case, you do it after 28 days, the other one after 21 days for the second dose. I would still do that. One dose will get you some protection, but again, it's not, you're risking a whole lot by just getting one. I would say 2 is definitely the way to go. Now, some countries, they are doing, because they're resource poor and they just don't have enough vaccine to go around, they're opting to get all their population, or as many of the populations, to get one, and then hope that someday soon they'll get another batch of the vaccine and they can get the second one in. That's a strategy that's dangerous, but I understand, trying to see this on a global perspective. I can see why some people get only one vaccine for that. Here in the United States, where we should be having enough vaccine, and what I'm hearing from most of the country is that we do have now a ability to vaccinate anybody who wants to be vaccinated. Getting it to them is challenging, I know, in many communities, but we do have the Pfizer and the Moderna vaccine here. So if you have the chance, please do two doses of the same vaccine, if you can, of the Pfizer Moderna in this case. But I think, if we look at other parts of the world, there is differences in what they do because they don't have the ability to vaccinate everybody.
So right now for the mRNA vaccines, the Pfizer and Moderna that require 2 doses, the CDC is recommending that you complete the 2 doses. And for teenagers, to Marlena's question, the CDC at this time is also recommending that the teens have these 2 doses. So for now, as community health workers promoting vaccines in our community, we need to follow the CDC recommendations about what is needed. So if one dose is not enough, if it is the Moderna or Pfizer vaccines. But there is another question here, and let me see if I can find it.
Yeah, Elvira Carvalho.
Johnson.
¿Qué pasa con las personas que se pusieron la Johnson que solo fue una dosis? And so the Johnson is still recommended as 1 dose. So at this point, that's what we are. If you got the Johnson & Johnson, that is fine. In many parts of the world, that's the only thing that's available. And so we would go with that. So far as I know, they're not recommending a second dose of Johnson & Johnson at this time. So I think 1 dose of that is what's been studied, and that still gives you good protection. It's not as the percentage is a little bit higher for coverage in terms of Pfizer and Moderna, but it's still much better. And I have not, again, this is my experience, that I have not seen anybody in recent months have to be hospitalized or intubated and put on a ventilator who had the Johnson & Johnson vaccine. So, even if you have a chance to, get the Johnson & Johnson because the other ones are not available. And I think at MCN now, we have been recommending the Pfizer and Moderna if you can get that, and the Johnson & Johnson, so long as you're not a woman between the ages of 18 and 58, I believe. That's what our website is still saying. Correct, Amy?
Correct. There's another question about if a person gets 1 dose and then has to travel or miss their second dose, should they get that second dose?
So yes, the answer is yes to that. And this brings up a different point, that we at MCN also have a database called Caseworthy, and we are working with farms and farm workers and caseworkers who go out and vaccinate somebody in one farm, and then 28 days later, that farmer is going to a different farm, and we can get their records into our database and then send it to the next farm that they go to, and also remind them through various social media platforms that they're due for the next one in the next coming days. So this is another service that we offer through our Caseworthy database system for vaccinations right now, that somebody who is going to get their wants to get their second vaccine but doesn't have the opportunity where they're going to be leaving the one place and going to another receiving place, we can make sure that they get covered and get that second vaccine. So even if you're many days out, you don't have to start over again. You can get the second vaccine. Ideally, it'd be the same one. We don't have a lot of data on switching between different vaccines at this time. So if you get the Pfizer the first time, please try to get the Pfizer the second time as well. But if it's longer than 28 days, or then you can still get it, and it will still be useful for you.
So Willard Tillman is listening on the phone, and he's having a meeting in rural Oklahoma, and he's wondering about how to be able to offer vaccines on site. This is a mostly Black farmer families and rural residents. So Dr. Laz, if you just let me pipe in here, and then others might have some answers. So this is one of the challenges for our project, because we are dependent in each of our communities, by and large, on the local resources. So we are dependent on our local health department, we're dependent on local pharmacies, sometimes local hospitals, sometimes our community health centers. And so what I'd like to do is to help Willard identify in his community the vaccine provider. So the first option would be to work with him to reach out to the local health department, and also will help locate the local community health center. What we are seeing is that one health department is one health department. One community health center is one community health center. That means that they don't all function equally. Even on the eastern shore of Maryland, where I am located, we have 3 counties very close together, and we have some very excited health departments and others not so anxious to do mobile clinics, but that is changing. So I think the part of what we'll work on in this project is to help you sort of figure out who are the best resources to help do vaccine clinics, to help do mobile vaccine clinics. How do we help them administer these vaccines in a way that the community feels safe, that the community feels trusted? So Moses, I would like to follow up directly with Mr. Tillman after this, and just touch base and find out some more specifics, so that we can potentially provide him some technical assistance to help get that conversation started in his community.
Will do. And Lorette had sent an email, I believe yesterday evening, regarding the same question. So we'll be looking into it.
But his question is a good one for all of us. And as we move forward, we'll work to strengthen those relationships. Sometimes we already have great relationships, and you pick up the phone and you call your colleague or your friend or your neighbor who works in the health department, and bam, you get a vaccine clinic. Other places, not so accommodating. And so we really want to help everyone be able to improve those relationships if the relationships are weak, and where the relationships are strong, build on them. But we recognize that every community is different, and the institutions that are supposed to serve us, sometimes they need to have a better understanding of the community, and that's what we can help do.
And I think that's why it's so important to talk with people who know the language, the community, their culture, local, because I can give you general answers, but they may vary, across the United States in different communities, where what's available and what can be accessed. There's a question here. It's a very good question. Again, Monica Monteo says, what if an individual gets COVID after their first dose? When will they be able to get their second dose? So that has a lot of different answers to it, depending on the patient themselves. If they get a mild case, they don't have to be hospitalized, versus if they get really hit hard and we put them on steroids and intubate them, and they're in there with us for a month at a time, which I've seen many, many times in 2020. And then they have to be rehabilitated with physical therapy because they've been intubated for a month. These cases, then you're very weakened, and I would hesitate to get the second vaccine until they build themselves back up to a point where they could get that second vaccine. So it really depends on the individual much more. And I think the CDC has some minimal guidelines there too, Amy. I don't know if you have that up on the website there, but I try to individualize those as a clinician myself, because not everybody who gets COVID, responds the same way or recovers. So there's many different ways that people handle and their immune systems are stronger or weaker by this experience, and so it's very challenging. The second vaccine will be given, but if you give it too soon, there may be the effects of it, the effective secundarios may be pretty strong if they are still kind of in that state of just recovering from the first the infection itself after having gotten the vaccine.
So
I'm sorry, Amy.
Go on, Moses.
Lorette had her hand up. I'm not sure if that was in regards to Mr. Tillman's question or the new question she just posed right now.
Yeah, go ahead with the new question, which, basically, what about when families have a difference in opinion about vaccines? And, I know a family that's related to me that has an 18-month-old baby, and the wife is pregnant. She had a miscarriage. The wife is vaccinated. The husband refuses to get vaccinated, at least until there's full approval. And he also believes that his wife and others had, there were 2 other women that had miscarriages, and they were all with somebody who had just had a vaccine. And he believes that the miscarriages were related. And, those are the kinds of questions you get, oftentimes also that how are the women vulnerable when their spouse can't decide what is resistant to vaccines?
Yeah, so there's a lot of individual variations on that as well. And first of all, people who are pregnant should be vaccinated. That's a recommendation. Also, I want to just address this part in that there's questions of infertility, and I keep mentioning to my patients that in the phase 3 trials of Pfizer and Moderna, people got vaccinated, and women who got vaccinated did get pregnant during the follow-through phases, months and months after being vaccinated. So it has not been a problem. And I followed with our OB group in our local hospital as well. They're still recommending please getting vaccinated, and that protects especially this 18-month-old baby. This is not what we want to see. What we see in Louisiana and other places in the country, that kids will get sick because of being exposed to family members who decline to get vaccinated. But it is a hard message to get out there. It's just we just keep trying. It is hard to get, if this dad just wants to not get vaccinated and it feels like it's more harm than that takes a lot of talking to and convincing. But
so
yeah.
Dr. Laz, we
Yep.
are these are some great sort of case studies, both with Mr. Tillman and the question that Lorette is asking. And I think that we're running out of some time, but these are exactly the kinds of questions we're going to try to bring in as we move forward, and be patient. It sounds super exciting. There's lots of questions, and we want to share all this knowledge. And so we'll put some time aside next week again to continue the conversation about this. In the meantime, I do want to make sure we get to one last question. It is an individual question, so we really want to encourage some of these individual questions to touch base with providers, but I think, Laz, will put it out there as a general question, just because if you could able to answer it, but recognizing that we're not able to give individual medical advice on this call. So Ramirez said that his son had heart surgery 8 years ago, and he's 13 now. And knowing that, would you recommend two doses?
Yeah, I think if you've had the if you're going to go with the Pfizer and the Moderna, then 2 doses is going to be important. I would talk to your cardiologist in terms of, you know, what kind of heart surgery. Again, there's ablations and valve surgeries and so many different types of surgeries of the heart as well, that I would try to be more specific with both your primary care physician and your cardiologist to say, you know, what are the risks and benefits. I think anybody with heart surgery or anybody who's had illnesses that could be jeopardized because COVID can really harm them will be better protected from not getting COVID than the risks from the side effects of vaccination. So that's the general principle. But again, an excellent question. I would get more information, and the cardiologist, the primary care doctor may work together that to, you know, help you answer the question a little bit better, more specifically.
So Moses, do you want to finish us off so we finish on time?
Yes, so thank you again for all those informative questions. We'll make sure to get back with some of you on some of your questions and feedback. Some resources for y'all to go ahead and check out and is the Migrant Connections Network, the National Resource Center for Refugees, Migrants, and Immigrants, and Migrants, and the Centers for Disease Control. We will be sending out the slide deck. We will be having the video available for everyone, and we'll send that out through email to everyone, hopefully by the end of the day. That's our goal. If you have any questions or concerns, or want to go ahead and add some TA, technical training assistance, reach out to me. Thank you for participating in our event. Our next week, we'll be doing the Vaccinationist campaign, and that'll be on July 20th at the same time.
And please remember to fill out the evaluation. We've been sharing the link to in the chat. We will remind you to fill the evaluation on the email when we send the materials. This is a quick 3-question survey for you guys to share your thoughts and experience with today's discussion.
Again, thank you for all the hard work that you do. I mean, this has been a really hard year for, you know, many of us who've been working in healthcare for 25 to 30 years. This is a really hard year to do case management, social work, community work, working with the populations we care about. And so thank you for all the hard work that you continue to put in. Muchas gracias a todos. Buen trabajo.
Great.
And thanks for the outstanding questions. We want to hear your questions, and so we will provide time each week to give you an update and to hear these questions. And also some of the questions where we'll be following up with technical assistance and support. We also want to share some of the outcomes and some of the best practices and strategies that are working well in your community. So this is already an awesome group with great questions.
Yes, completely agree. All right. Millie, anything before we end the session today, Millie?
No, mucho gusto a todos y todas, y seguimos aquí en la lucha. Y si hay preguntas, por favor, aquí está Amy, Moisés, para apoyar, a responder lo más que se pueda. Recuerden, están para servir, están para apoyar en el proyecto para que tengamos éxito. Muchas gracias. Un abrazo.
All right. Thank you. Thank you all. Have a great day. Appreciate it.
Thank you. Gracias.